Hello, my name is Dr. June Kay, and I'm the director of the Johns Hopkins Adult Epilepsy Monitoring Unit. I'm a neurologist who cares for adult patients, and I specialize in the treatment of seizures and epilepsy. The videos that you are about to watch will help orient you to our adult and pediatric epilepsy monitoring units, help prepare you for your hospital stay, and let you know exactly what to expect while you are here. The Adult Epilepsy Monitoring Unit is located on the 12th floor east wing of the Johns Hopkins Hospital in the Zayed Tower. The Pediatric Epilepsy Monitoring Unit is located on the 10th floor of the Charlotte R. Bloomberg Tower in the Johns Hopkins Children's Center. There are 6 private rooms in the Adult Epilepsy Monitoring Unit and 4 private rooms in the Pediatric Epilepsy Monitoring Unit. Each room has a sleeper sofa. Parents or guardians of pediatric patients need to stay with their children, including overnight, while they are in the epilepsy monitoring unit. The goal of the epilepsy monitoring unit is to find out more about your seizures or other events that might look like seizures. This will help us characterize them and determine the appropriate treatments. All rooms are equipped with 2 cameras that record video and sound from different angles to help capture events clearly and to support your safety during your stay. We record your brain's electrical activity with an electroencephalogram or EEG. The activity is monitored along with video and audio so that the team can match any symptoms or events with the EEG recording. In addition, we ask patients and their visitors to describe out loud what they see and hear during these seizures. This helps us connect the activity that we see on video and the description we're being given with the EEG reading. Some patients are admitted to the EMU because they're candidates for epilepsy surgery. Typically, we already know that these patients have seizures, but we want to learn more about where those seizures are coming from.
I'm Dr. Sarah Kelly. I'm a child neurologist specializing in epilepsy, and I am the director of the Pediatric Epilepsy Monitoring Unit. In the epilepsy monitoring units, you will find a number of providers who are trained in the care of patients with seizures. We have physicians, the attending physician, and the epilepsy fellow, who look at the EEG on a regular basis and make treatment decisions when the patient is in the monitoring unit. We also have the resident team, who cares for the patients on a daily basis, and the nurses and technicians who are trained in the recognition and response to seizures.
Every morning, our clinical team reviews the EEG recordings to check if any events are seizures and, when possible, what type of seizure is occurring. After that, the entire EMU team will meet with each patient in their room to discuss what we found and what happens next. The epilepsy care team is typically composed of doctors, nurses, and trainees.
Typically, patients are referred to the epilepsy monitoring unit by their physician. Often, their neurologist or their epilepsy specialist will refer them for evaluation. And they refer them for a number of reasons. The most common one is to determine what type of episodes a patient is having. Next, to determine is there a surgical option for treatment. Finally, to make medication changes in a safe and controlled environment. After a patient is evaluated in the epilepsy monitoring units, the information we gather during the stay and information that we have from their prior evaluation is taken to our weekly epilepsy conference. This conference takes place on Tuesday mornings, and all of the epilepsy specialists are there, as well as a number of colleagues from various specialties. We are very fortunate to have wonderful neuropsychologists who we work with both here at Johns Hopkins and also at Kennedy Krieger Institute. And they come to our conference along with the neurosurgeons as well as nursing personnel and technicians. We all work together to come up with the best recommendation for the patient. When a patient is discharged from the epilepsy monitoring unit, we ask them to call their attending physician to make a follow-up appointment. This appointment is generally a number of weeks out so that we have a chance to see if the treatment changes that were made are effective for the patient. And also, so we have time to look at all of the data we discuss in our epilepsy conference and think about the best recommendations for the patient.